Hello, everyone out there. It's your boy Ovi Mark. You're welcome to Artified Optimist. Good morning, good afternoon, good evening to you wherever you're watching from all around the world. Today, I have this news for you. This one is from the Punch News, and it says Edo, Plateau, Bauchi, Ogun record 85 fresh cases of Lassa fever. Let's quickly take this news and see what we can do to protect ourselves. 576 persons tested positive to the virus in Edo State. 5 cases were confirmed in Plateau State, and another 3 cases were recorded in Bauchi. The Commissioner for Health in Edo, Dr. Patrick Okundia, said on Friday in Benin that 76 out of 175 suspected cases of Lassa fever tested positive to the epidemic. Okundia made the disclosure at a Lassa fever committee meeting chaired by the state deputy governor, Mr. Philip Chaibu, and representative of the World Health Organization. He said a total of 76 suspected cases of Lassa fever were confirmed on Friday in the state, and they are currently on admission in the Ira Specialist Teaching Hospital. We have not recorded any new deaths, but have also reduced our case fatality rate to less than 10%. The number of cases in the world now is 34, and we have discharged over 28 patients that have been fully treated and cured. In his remarks, Tribal called on all hospitals across the 18 local government areas of the state to refer any suspected cases to Ira Special Hospital and isolation centers, the news agency of Nigeria reported. On her part, the state coordinator of World Health Organization, Mrs. Faith Ireye, revealed that contact tracing in the state was the best in the country. I beg your pardon. Mrs. Faith Ireye revealed that contact tracing in the state was the best in the country. In Plateau, the Commissioner for Health, Dr. Nimkong Ndam, I beg your pardon, said the state confirmed 5 cases of the epidemic. Ndam, who spoke in Jos on Friday, said the patients of the ailment had been admitted in 2 hospitals in the state, adding that 3 of them were undergoing treatment. One had completed treatment, while the 5th one had been discharged. He said Lassa fever was not new in the state because the area had experienced the disease before. In Bauchi, the Executive Secretary, Primary State Health Care Development Agency, Dr. Riwan Muhammad, confirmed 3 new cases of Lassa fever in the state. Mohammed, however, said that there was no record of any death in the state since the outbreak. He said a sample of 15 other cases which were suspected to be Lassa fever had been sent to the National Disease Control Center in Abuja for testing to authenticate them. We heard of the news of some deaths in Kano as a result of Lassa fever, and there are a lot of speculations going on regarding Bauchi State. This year we have 15 suspected cases of Lassa fever. 3 out of these have been confirmed, while 21 turned out negative. What happened was that a lady who lives in Kano came back to Bauchi to see her family and stayed for some days in Bauchi and later traveled to a village in Toro local government area. Anambra urges residents to start setting rat traps. Meanwhile, as part of the measures to prevent Lassa fever, the Anambra state government has urged residents of the state to embark on massive setting of rat traps. The state governor also said the state had opened dedicated telephone lines for Lassa fever alerts in the state. The Commissioner for Health, Dr. Vincent Okbala, said this on Friday at a press conference in Oka, the state capital. While saying that no case of the virus had been reported in any part of the state, Okbala said there was need to be more vigilant as there had been cases of the disease in 2 coterminous states. He added, to reduce the risk of Lassa fever, the Nigeria Center for Disease Control and Anambra State Ministry of Health offered the following advice: keep your environment clean at all times, Block all holes in your house to prevent rats from entering. Cover your dustbins and dispose refuse properly. Communities should set up dumps very far from their homes to reduce the chances of having rodents within homes. Store foodstuffs like rice, gari, beans, corn/maize, etc. in containers which are well covered with tight-fitting lids. Avoid drying foodstuff outside on the floor, roadside where it will be exposed to contamination, among others. Meanwhile, the Rivers State government has placed 57 persons under close surveillance. The acting permanent secretary, State Ministry of Health, Dr. Chinwe Atata, said on Friday that 2 suspected cases had been investigated and discarded, while 2 samples had been collected and sent to the National Reference Laboratories for virology. Atata said, however, the state was notified of a resident of Rivers State who was diagnosed in Edo State as a case of Lassa fever on January 22nd. Incidentally, the patient passed on at Ira Specialist Teaching Hospital same day. Investigation is ongoing in Edo State together with the management of the hospital. The family and National Center for Disease Control are working assiduously to ensure public health safety in exposed clusters, especially among healthcare personnel and the first responders. Currently, 57 persons have so far been placed under surveillance. We are working in partnership with state, federal agencies, and all stakeholders in the interest of public health security. There is therefore no cause for alarm, as the situation as recorded is firmly under control. In a related development, the Osun State government has mandated all local governments, local council development areas, and administrative offices to immediately begin grassroots sensitization of the citizenry to prevent the outbreak of Lassa fever in the state. Commissioner for Local Government and Chieftaincy Affairs Adebayo Adeleke and the Special Advisor to the Governor on Public Health Olasiji Olamiju made this known during an urgent sensitization meeting with the Council Chairman at the Ministry of Local Government Conference Hall at Berry on Friday. Also, Lassa fever has reportedly hit Abeokuta, the Ogun State capital. A case was reportedly recorded in Obantoko, Abeokuta local government area of the state on Friday. A source at the Federal Medical Center, Idiaba, Abeokuta, told one of Punch's correspondents that the victim was taken to the FMC Idiaba, Abeokuta Friday evening. The source said after a series of tests were carried out, it was confirmed that Lassa has crept into the state again. The state had recorded the case last year but got rid of it. The Ogun State government had a few days ago said there is no confirmed case of Lassa fever in the state. The Nigerian Center for Disease Control had listed the state as one of the states with a case of Lassa fever in the country. Commissioner for Health, Dr. Tommy Coker, in a statement released a few days ago, added that government had however put its health officials on red alert in the event of suspected case. Attempts to get the Commissioner for Health reaction failed, as she could not be reached as of the time of filing this report. A press officer in the ministry who pleaded for anonymity confirmed the case. The officer, however, begged for more time to reach out to the top management in the ministry and promised to get back to Punch's correspondent. So there you go, people. Now it's official. We have another outbreak of Lassa fever in the country. But the good thing is the authorities are swift and on top of this matter. I'd like to advise everyone out there, to all my listeners, tell your people, tell your friends, your relatives, your loved ones, people around you, your neighbors, to be very careful this season. And just like it was done in Anambra State, where the government advised everyone to embark on massive setting of mouse traps. If it's possible, please get mouse a mouse or mice traps all over your house, your streets, wherever you can. Just get these rats out of the way, and do take safety precautions. Be careful with your food. Block all holes around your home so rats can sneak in, and make sure your foodstuffs are always covered. Stuffs like rice, beans, gari, put them in containers that have airtight lids so rats don't get into them. And just to add one more, please cover your sources of water. Your storage cans for water, make sure they're always covered. So there you go, people. Lassa fever has broken into the country once more. Remember, if you are cautious, if you have prevention in mind, you will never catch it. So no need to panic. The government is on top of the matter, but we as citizens will also have to be careful on our part, okay? Hygiene plays a very, very key role here. Make sure your dustbins are emptied regularly. Make sure your environment is clean and void from refuse around. These are the things that attract rats. Okay, people, so protect yourself, protect your families, protect the people around you. All right? So have a blast, people. If you haven't subscribed to the channel, please do subscribe by clicking the subscribe button just below this video. Also click the bell notification icon just beside the subscribe button to get notified every time I drop new videos. Like the video, share the video, drop a comment below. Okay? Thank you guys for sticking around. Have a blast, guys. Adios.